Hello there. It's Wednesday, April the 8th, and it's time for we've been calling it the Mayor's Briefing, although these days the Mayor is so busy it's a little hard to be able to catch him with a special City Council meeting scheduled for noon on the 8th, which we hope to cover in the future and get the results of that. Instead of Mayor Koplin, Kathy Renfeld from the Incident Management Team, one of the public information officers of that team, is going to sit in and bring us up to speed on a couple of things having to do with testing and also with resources for fishermen. That's next here on today's Daily Briefing. So, Kathy, nice to be visiting with you. Conversations between you and I on the radio are certainly not a new thing for either of us. So let's dive in and talk about first an area that has been of great interest to folks, and that is testing and what's available and is it expandable? You guys have a development there.
Sure. So as of today, there have been 10 people in Cordova who have been tested. We have received all the results back, and they are all negative. So we have 0 positive cases in Cordova. Right now, we are using the traditional testing mechanism, which tells us if you currently have the COVID-19 virus, and that is being administered by CCMC and Alonka Community Health Center, and it's being administered according to CDC guidelines. And right now, how it works is you go in for the test. The staff is all donned in their PPE, so you need to call ahead. And you get the nasopharyngeal swab, and that gets put into a medium and sent off on an airplane, and it gets tested, and the results come back anywhere from 3 to 7 days. The average is 5 days. And during that time, you do need to be in quarantine isolation, where you are isolated even from others in your own household. And we're excited to hear that there was actually a new type of testing machine that was going to be available and being sent to the native village of Eak, Alonka Community Health Centers. So this new testing equipment, there was 40 of them that were purchased by the Alaska Native Tribal Health Consortium, and they're called Abbott ID Now COVID-19 Rapid Testing Machines. So the distribution is expected to have already started, and the Alonka Community Health Center is awaiting the machine's arrival. It can process tests in as little as 15 minutes, which is very exciting.
Wow.
However, the machine will only come with 48 tests. So this is a real limitation for us. Testing supplies are controlled by the federal and tribal governments, and they're distributed through those channels. And the Cordova's medical response team, which is an active part of the city's incident management team, IMT, has been reaching out to see if more of those specific kind of ID Now COVID-19 rapid testing supplies can be sent to Cordova right away so that we can do some broad-based testing. But we're told that they cannot order more until the tests are released by those entities. And how things have been going so far with ordering supplies and receiving supplies is that supplies are held. All the COVID-19 and emergency response supplies are held by some agency. Typically, it's FEMA or DHSS, and then we can put in a request, and then they will process those requests, and it's based on need and availability. So if they have it and you're considered to be of the greatest need of those who have requested it so far, then they'll send it to you. And it's kind of a catch-22 because we don't have any positive cases in Cordova. And a lot of people think that if we were testing more, we would have some positive cases, and that's totally possible. I think we should all be operating under the assumption that there are positive cases walking around. I think that's going to be a way safer way to operate for everyone, whether it's true or not. Mm-hmm. And I think it's totally possible that there could be some positive cases in Cordova that have not been documented because they haven't been tested because those people don't fall into the CDC guidelines for testing. But it's a catch-22. We can't get more supplies until we are considered to have a need, and we don't have a need until we have some positive cases. So we are doing the best we can to try to get more tests. And, the studies show that broad-based testing is a great way to slow the spread. And if we can do that, we will. But right now, we can't. there's not availability of that we know of right now. We are still pursuing that and still seeing if that's something that can be done. But right now, the local doctors are going to be still following those CDC guidelines for testing.
Okay.
And it's important to note that even if broad-based testing were currently available in Cordova, social distancing is still the number one method for slowing the spread of COVID-19.
All right, good. Well, a lot of very thorough information there, and again, a subject that has been of great interest. And, you reinforce the point that it's critical for people, whether we have testing or not, to assume and respond as if it's out there, with the social distancing, with the use of masks, all of these recommendations, no matter what the situation, that's going to be what protects folks the most. Now, the other area of greatest concern has had to do with the influx of fishermen, and there are some resources that the team wants to direct folks towards. So what's the story there?
Sure. So, there's, as a lot of people have heard, the incident management team has started a commercial fishing task force, and they've begun meeting, and they're working to ensure clear ideas about how to manage Cordova's harbor and fleet as they arrive. And one of the things that members from that task force have been working on their own, even before we all started meeting, they've been working with fishery industry leaders from around the state and collaborating with an agency called Discovery Health MD. So they've been working together to create sample onboard procedures for catcher boats and tenders that'll help prevent the transmission of coronavirus when the salmon season gets underway in the coming months. And so yesterday, Discovery Health MD released a reference guide. And this includes draft procedures manual, a draft checklist for captains, a number of handouts for crew education, and a notice from the state of Alaska on the use of cloth masks during air travel. So hopefully that's something that we'll see come into more regular use, that when folks are traveling for commercial fishing, that they're going to be using these masks as they're traveling. More information on that in the full document can be viewed at amsea.org. That's AMSEA.org. And there are also more sample plans that include the large vessel information. The ones I'm referencing earlier are more for small vessels and tenders. And so the full gambit of plan vessel information can be found at ready.alaska.gov/COVID-19-worker mitigation plan. And we do have links that are going to be going up on Facebook for those as well. A lot of gill netters have been asking for a template to work from for their state and city mutual aid plans. And an important note about this document is that it's not a standalone plan. It's just intended to be used when regional fisheries and gear groups of fishermen are making and submitting their mitigation plans. And if any fisherman has questions, they can reach out to Chelsea Hazeman at CDFU or to Krista Hoover at Copper River Marketing. Both of them were involved in the drafting of this document, and they understand how to apply it to different vessel configurations. So just to clarify, there is a state plan that's going to be required for most commercial fishermen, especially if they are coming in from out of state or if they're bringing in anyone from out of town. And then regardless of whether you're bringing anyone in or not, you do need to fill out a mutual aid agreement with the city. And we're actually developing a series of infographics. We just finished them today, and we're probably going to be releasing them today on our Facebook page. That hopefully will help explain some of these finer details about what fishermen should expect, what they should prepare for, and what they need to get done before they get here or prepare for on their way here.
All right, Kathy. Well, it sounds like the team is doing a real good job of focusing on the things that concern people the most. And I want to thank you very much for stepping in for Clay, who is actually in a meeting as we are getting ready for one as we speak, that special council meeting. So thank you, and you stay safe, and we'll look forward to talking to you again.
You bet. Thank you.
Our thanks again to Kathy Renfelt, one of the public information officers from the incident management team, for sitting in for Mayor Clay Koplin, who is extremely busy as things rapidly develop in Cordova's response to the COVID-19 situation. These daily briefings air in the 1 p.m. hour, 5 p.m. hour, and 8 p.m. hour on KLAM and KCDV. Also archived on our YouTube channel, the Cordova TV channel specifically. That's youtube.com/Cordova TV. Share this information around, whether you tell folks about it or direct them to the program, because the more people know, the better a job we're going to do dealing with this thing. And thank you for tuning in. Remember, the archive not only includes these briefings, but also the extended FAQ sessions with the incident management team and the talk shows. And we actually covered some of these topics, well, both of these topics discussed today during the talk show earlier. So when I had a little bit more time to get into detail. So if you want to catch that, it would be the April 8th version of Town Meeting. Have a great day. We'll get regular programming back underway for you on the Clam and the Eagle.